All right, we cross live now to Chicago. We'll speak to Chime Asonye, who is the founder of Nigerian Mental Health, the organization behind the suicide prevention bill and its translation into major Nigerian languages. Glad to have you join us on the world. Chime, what provoked?
Thank
Let me
you so
start.
much.
Good. Thank you. Let me start by asking you what even provoked this? How did this? What
Yeah.
provoked it?
So, so the first thing is that today is a special day because we stand in the middle of Suicide Awareness Month. So there's been a lot of work from global, local, and international actors to promote things around mental health crisis and suicide awareness. And so this bill is a follow-on to consolidate the gains of the Mental Health Act that was passed around 3 years ago. And but we can't get individuals to seek the help they need if suicide is still criminalized and there's not important attention around mental health crisis. So this bill was introduced, as you mentioned, in February. And it's important to note that mental health and acute mental health challenges is everybody's concern in Nigeria. And so we want to give people the rights and responsibilities that were critical for them in the suicide prevention bill by promoting it in the different Nigerian languages. So from the north to the south, everybody understood that this is a challenge that everybody's impacted. And we've seen that lately. In the north, most recently in Kanu, they were clapping when someone was about to attempt suicide. They dug their grave. We've seen it in the east, in places like Enugu. There was a lady, unfortunately, that had post-traumatic stress disorder and unfortunately took the life of her babies and almost took the life of herself. These individuals don't need the stigma around these things. They need our support and challenges. They don't need jails. They need individuals that can support and help with their crisis. So it was very important for us to push this National Suicide Prevention Bill that's been introduced for first reading and discuss it on this important awareness month of suicide awareness.
Interesting. So what you're invariably saying is that there's a correlation between mental health and suicide.
Yes. A couple of things here. Unfortunately, Nigeria has the most cases of depression in in on the African continent, and not only that, we have one of the highest suicide rates. We're the seventh largest on the continent, and we're the 15th largest globally. And when you think about, a lot of people think about things like mental health and suicide as a white man's problem. It's not. Most of the burden when it comes to mental health crisis and suicides actually happens in low and middle income countries like Nigeria. Around 70 to 90% of the suicide burden is in our area, and the highest demographic for suicide is actually African males. So there is an important correlation between these things, but it's important to provide that we promote it as a public health issue. And that's what we want to do. One of the things that people don't realize is that in countries where suicide is criminalized, according to a study from BMJ Public Health in 2022, suicide rates increase, especially amongst women. There's been a global best practices to decriminalize attempted suicide. 3 countries just this year have decriminalized attempted suicide. Nigeria is only one of 20 countries that are left that still have it, and it's not even a Nigerian practice. This idea of criminalizing a public health issue was something that was imported to us by the British. It's colonial, unfortunately. The year after Nigeria went independent, Britain actually decriminalized suicide and passed regulations for mental health crisis. So it's backward policy, it's antiquated, it doesn't approach issues of mental health crisis in the important work that it's supposed to. And we need to make sure that we double down on the gains of the Mental Health Act that was passed to make sure that people actually get the help they need. And I would like to say also that this is not just something that Nigerian Mental Health is working on. We're working in collaboration, for instance, of the launch of the different mental health versions of this suicide awareness prevention bill. We're working on it with Senator Asuquo Ekpenyong from Cross River State, who sponsored the bill, and other legislators who believe very importantly in mental health crisis. We're working with it with the Nigeria Suicide Working Prevention Group. We helped work to draft the bill, introduce it into legislation. So there's a cross section of stakeholders, from human rights defenders, from psychiatrists, psychologists, to media, that think this is very important to get the awareness out there and let people know what their rights are when they need this acute care.
You couldn't be more right, or I couldn't agree with you more. I mean, why would anybody want to criminalize? The moment somebody wants to commit suicide, automatically you know that there is a psychological problem with the person. So why anybody will criminalize somebody who wants to commit suicide is beyond you and I. But how do you, I mean, you have symptoms if you're having other diseases I can't quite remember off the cuff now. You would know the symptoms and then you begin to want to treat them. What are the likely symptoms of somebody wanting to commit suicide, or somebody who is going through, who is manifesting? How do you know somebody who has a mental health issue, and what really causes these things? I mean, I can have a few on my head, but let me leave that to you.
Too. Well, I let's be honest, the things that push people to take their life are multifaceted. They could be structural, they can be environmental. So they could be, mental health could be an issue, but we also know that in a place like Nigeria, there could be socioeconomic challenges, unemployment, there's issues of youth anxiety, there's issues of technology. So it's multifaceted, and we need to think about the social determinants of health. So that's why this bill is very important. It just doesn't decriminalize attempted suicide, which is important because in the penal code, it actually subjects individuals to a year in prison, which basically punishes them for having a crisis. But it does other things. It provides structure for prevention. It ensures support services for those that are distressed and public health. And I would like to say that if individuals are having challenges, there are places you can get help. In Nigerian Mental Health, for instance, we have a resource hotlines that we curated from around the country. People can go on there and they could call our crisis hotlines, and individuals will provide them the support that they need in any of the lines that they have there. We also have a new thing that we launched, which is a mental health rehabilitation and services directory. So if you don't want to talk to someone individually, you can go to a physical place. So if people need the support, they can go to our helplines and our directory to get the resources that they need.
Let's get to hear the helpline. Somebody's probably listening in now. So let's get to hear the helpline.
So you can go to www.nigerianmentalhealth.org and you can get access to crisis hotlines, or you can get access to our mental health and rehabilitation directory. So no matter if you want to make a phone call,
again? Could you just take that once more?
Physical facility. It's www.nigerianmentalhealth.org.
Do you have a line? Is it apart from the web? Do you have a line?
Yes, we have multiple lines. That's what I'm saying. We curate.
Call the line.
We have a network of over 50 plus organizations. I don't want to call one specific line because we curate. For instance, Lagos State has a line. Our NGO partners have lines. So actually curate
so the best is
all
the web.
The lines out
the best
there.
Is the web.
Yes.
Okay.
All right. The best is to go on the website and to access the ones that you find more accessible to you.
All right. Just for the last time before I let you go, just call that web again for the last time before I let you go.
www.nigerianmentalhealth.org. And we're so excited for our 50 plus partners that work with Nigerian Mental Health,
Fantastic.
Nigerian Suicide Working Group that we're working with to push these resources and make sure that we get this natural suicide prevention bill, hopefully the second reading during this period.
All right. Thank you so much, Chime Asonye, founder of Nigerian Mental Health, the organization behind the suicide prevention bill and its translation into major Nigerian languages. Thank you so much. That's very key. That's very important because in these days, people are having mental challenges indeed.